Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with your educational videos about optimal health and the most innovative and holistic approach to your well-being. In this month's video, let's take a look at how you can manage and heal diverticulitis with natural and effective therapeutic tools. Diverticular disease can be a very painful and upsetting disturbance in the digestive tract. In severe cases can lead to hospitalization and even surgery due to the complications of the diverticulitis symptoms. In this video, I will share with you effective tips so hopefully you can avoid an invasive surgery. Enjoy this video. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. And thank you so much for your thumbs ups and likes as they help the growth of my channel. And lastly, have a look at my website, medicanova.net, at the online academy, where you will find certified, inspiring home study online courses in homeopathy, mental health, health and wellness coaching, quantum healing, and so much more. And another great little tip, I have passed the National Board exam for health and wellness coaching, and therefore Medica Nova is now offering 3-month smoking cessation programs. So for more information, contact me at health@medicanova.net. So what is diverticulitis? Well, diverticulitis occurs when you have one or more pouches or sacs, we call them, in the wall of your colon that has become inflamed. And these small pouches, they are also called diverticular, most commonly in the lower part, on the left side of your abdomen, also called the sigmoid colon, form and push outward through weak spots in the colon wall. So when the pouches form, this is called diverticulitis, which usually doesn't cause any problems, really, or pain. But when the pouches become now inflamed or infected, then yes, it can lead to serious complication and even to hospitalization. So we have the name diverticulosis and diverticulitis. Now, diverticulosis is really just saying that you have these pouches, you have these sacs, but you really don't experience any symptoms. Whereas with diverticulitis, the infection is there. Any medical term which ends up in itis means it's an inflamed condition. Right? Something has happened here. So when the diverticular sacs become blocked with fecal matter, allowing now bacteria to build, this can result in an infection and inflammation. And as the sacs grow now or fill up with this fecal matter or decaying food, they put an increasing amount of pressure on the walls of the intestine, leading to pain. And here we have the gas, the flatulence, the bloatedness, the abdominal discomfort, and also other diverticulitis symptoms. So let's have a look at the overall symptomatology so you can recognize these symptoms within yourselves. A majority of patients really don't even know that they have these pouches or their sacs unless they have a colonoscopy and it is discovered. But about 10 to 25% of patients develop symptoms. And that may range from, significant abdominal pain associated maybe with fever, leukocytosis, which is an increase in the white blood cells, and also requiring hospitalization. Of course, we talk about abscess, fistula, peritonitis, and all of that. Often with diverticulitis, you experience short-lived phases. So you have an attack, so to say, and you get your supplements or your medication, and then for a few months you're fine again, and maybe you get stressed in your life or you experience constipation and back again. So in this video, we not want to talk about just healing the symptomatology, but the overall story. We want to have permanent healing. So the common diverticulitis symptoms is usually the pain in the left lower side of your abdomen, called the sigmoid colon. And we have a tenderness in the abdomen, definitely cramping, maybe colicky pain, bloatedness. It can be confused with irritable bowel syndrome because we sometimes see an alternation between constipation or diarrhea. When you get really bad into it, it can have fevers and chills, nausea, vomiting, and it can lead also to an abscess. And that means you have a painful, swollen, infected, and now pus-filled area which is outside your colon. And here you would need an ultrasound almost, or an MRI to see what's really going on, because a colonoscopy, only really tells you what's going on inside your colon. Sometimes we have perforation, and therefore we have a small tear or even a hole in the pouch of the colon. It doesn't mean that the feces go through yet, but the wall is really sensitive by now. But it can also lead to peritonitis, and then we have inflammation and infection of the lining of your abdomen, which is caused when the pus or the stool now leak through the perforation, through the hole. And that is a very serious condition, and you need, of course, surgery. Sometimes it can go into a fistula, which is an abnormal passage where two organs are affected. In this case, it's creates a tunnel or funnel here between two organs, and here it's the colon and the bladder, so you maybe also experience bladder symptoms. And then finally, the intestinal obstruction, where there's a partial or total blockage of the movement of the food and stool through the intestines. There are certain risk factors involved, and obesity is one of them. So you really have to start managing your weight. The age, it's more prone in elderly due to the sedentary lifestyle. Diverticulitis really demands you or requests you to move your butt. You have to exercise, and it's really helpful here. Smoking, yes, please, stop that. A diet high in red meat, lack of fiber, and also total fats like saturated fats really just add to the symptomatology. And then also if you take non-steroidal anti-inflammatory medications to quite an excess, that can make the diverticulitis worse. So what is the conventional treatment? Treatments for symptomatic diverticulitis disease is largely based on the symptoms. So the conventional medicine, although very effective also, really focuses only on the symptoms and not on the holistic overview, the whole patient here. So traditional, you will be, of course, educated in your lifestyle, in your diet, so maybe bring in more fiber in your diet, rest, antibiotics, pain control, as I said, maybe surgery in selected cases. But the goal is here more for a management of the diverticular disease. You likely will be given antibiotics or another drug called mesalamine, which is a medication that's commonly used to treat certain bowel diseases. It works by decreasing the swelling, the bloatedness in the colon, reduces certain symptoms such as rectal bleeding, stomach pain, and diarrhea. But it all comes with its own truckload of side effects, which really we want to avoid here. But of course, if you experience complications such as perforations, abscess, fistula, or bowel obstructions, you need to go to the hospital, and surgery may be a life-saving event here for you, and it is a must. So I'm not saying all of it can save your surgery, but I feel with mild or moderate diverticulitis, what I will share with you is effective and maybe can save you the surgery. So if you are interested in a health consultation either for yourself and or your children, contact me at Medica Nova at health@medicanova.net. Medica Nova is my practice for integrated and educational medicine. We offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and health and wellness coaching, and so much more. Book your appointment today. Let's move on to the second part of this video, food for thought, or the metaphysical meaning. I'm not interested in just giving you a sort of little band-aid for your diverticulitis. I'm interested in helping you and inspire you to heal and to create long-lasting healing. With diverticulitis, there is usually a story behind the physical expression, the symptom. And in this case, it's often deep anger or frustration. And I would like to refer to the references of Chuck Martel, because he really expresses this very nicely here. And in his words, he says, diverticulitis is an inflammation of the small cavities in the walls of the colon. This ailment is related to anger held back in my everyday life. I'm currently experiencing a situation in which I feel like a prisoner and to which I can see no end. This causes tension, pressure, pain, and sorrow. I feel trapped. My intestine becomes fragile, like my emotions. I'm constantly on the alert and expecting the worst. I'm secretive in and what I share with others. I won't allow anyone to penetrate into the nooks and crannies of my personal life, like the nooks and crannies and the pouches in the colon. You see the connection between the mind and the body here? The first step toward a solution is acceptance. How can I resolve something if I refuse to accept its existence in the first place? I therefore accept the situation as a reality, and I remain open to the divine channel that brings me the love necessary to integrate this experience. I let go of my resentments, and with my acceptance and my openness, various solutions become available to me because I'm no longer blinded by anger. And I share something personal with you. Many decades ago, I used to experience and had diverticulitis. It was very painful. And the story at the time in my life was related to a very difficult relationship. Yes, I felt resentment. Yes, I felt anger. And yes, I felt trapped. And the diverticulitis really resolved, of course, with many treatments in between, truly after I separated from this relationship. So I know what diverticulitis feels, I know what it is, and I know how you can heal it. I don't need to read a book about diverticulitis. I know it in detail. And that's why I can share with you, how to meet this situation in the most successful way. On another note, I personally feel, due to this global overall crisis and change what we all experience, here in the US, for example, we have the recession, the high inflation, the stock market, we have the bear market right now, the gas prices are through the roof. People are truly forced to look at their existing lifestyle, where they spend their money. There's a lot of anxiety, despair coming up, how I meet these bills suddenly. And therefore we will see more, I believe, more digestive diseases, because the digestive system is like the second brain. It's, the most part in our body which contains also, oh no, it's actually the part in our body which contains the most nervous system. So we see maybe more irritable bowel syndrome, diverticulitis, anything which has to do with a heightened nervous system. I believe these diseases come more to the forefront because that's what we're dealing globally at this moment. If you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths qualities in achieving the very best of you, then contact Medica Nova Wellness Coaching at health@medicanova.net for your 3 months coaching program. I am coaching you to be well. Let's move on to the natural treatment protocols. Diet is a big deal here with diverticulitis, and over the last decades, researchers have been examining the role of dietary fiber in the development of diverticular disease. And research really says that fiber found in fruits and vegetables has a most protective effect here, and a high intake of total fat and red meat therefore increases your symptoms. So increase your fiber. I would say 20 to 30 grams per day. Change your food into an anti-inflammatory food. And herefore, go to Google, go on YouTube. You find tons of resources here what anti-inflammatory food diet really means. It means really take the junk food out, right? Become more holistic. Yes, the organic food is more expensive, but maybe start growing a salad in your back garden or in your walled vertical vegetable garden in your little patio. Anything is possible. Often in the past I said don't consume nuts, popcorn in particular, and grains. The new research says no, it's good for you. I personally feel like it depends on the stage of your diverticulitis. If you have abdominal pain, flatus, and you crawl on the floor already, I would not use nuts at this point because they're hard, and even if you chew them well, these are parts which can sort of sit in these pouches for a long time and then ferment. I would go more for liquid food, for easy food. Definitely bring in more probiotic foods in the morning, as well as probiotic supplements, and reduce the consumption of red meat as well as alcohol. It is a must. Please be kind to yourself. With diverticulitis, you will need supplements. You can purchase them at your local health food store or online. My favorite are turmeric or curcumin, because it's anti-inflammatory, it's antibacterial, antiviral. So turmeric capsules, I would say at least 2 capsules in acute cases, maybe 3 times a day, or 2 capsules morning and evening, and then reduce it after a while to 1 capsule morning and evening, and really drag it out for a few months. Slippery elm is one of my favorites too. It comes in capsule form as well as in powder. It's an demulcent and it coats the inflamed areas. It also protects the irritated tissue and it heals it. Bone broth always helps here to digest the essential nutrients. I talked about probiotics first thing in the morning. Get your acidophilus and your bifidus in. If you have pain, you want to bring in maybe aloe vera gel or juice. 12 to 16 ounces is recommended on a daily basis. It helps the digestion, helps to normalize the pH level because you may be very acidic when you're inflamed. It regulates the bowel processes and encourages a healthy digestive bacteria. So aloe vera gel or juice. And when it comes in a gel, it's sort of a thick mucus consistency, which is actually lovely, and you mix it up with a lukewarm water, glass of lukewarm water. It's really nice. I also like licorice root. Comes in capsule form as well. It helps your digestion, especially if you have now acid reflux on top of it. It helps reduce the spasms and the inflammation in the gastrointestinal tract. So turmeric, slippery elm, probiotics, aloe vera, licorice root. These are all great, beautiful, what nature provides us, right? Help here and aids to heal diverticulitis. I talked about physical exercise and activity. It's really important here. Move your digestive system and your lower abdomen. If you don't want to move, exercise, do some qigong, tai chi. Use your breath to relax your nervous system within your lower abdomen. That would help. But if you have overweight or weight problems, please start moving your body a little bit. And I would say avoid the non-steroidal anti-inflammatory medication. I know you maybe need it in the first place because of the pain, but I will give you other solutions, and I think you will like it. Let's move on to the third part of this video, homeopathic remedies. Homeopathic remedies are true godsend here. And the combination of lifestyle changes, exercise, anti-inflammatory diet, introduction of supplements, being more mindful about the nervous system in your lower abdomen, and the exploration of your story behind your symptoms, I truly believe that you can kick diverticulitis. Why? Because I've done it. And if I can do it, you can do it. Homeopathic remedies for diverticulitis help reduce the inflammation of the diverticular, the pouches, and symptomatologically manage cases of mild to moderate diverticulitis. They help treat symptoms like abdominal pain, nausea, vomiting, constipation, diarrhea, and even blood in the stool. But if you experience severe diverticulitis, where there's maybe peritonitis involved, of course, you need to seek out medical help, and maybe a life-saving surgery is appropriate here. But this video should educate you, so maybe you don't need a surgery in the first place. The most common indicated remedies are colocynthus, magnesium, phosphoricum, or nux vomica, but in this video I will give you a longer list of indicated remedies. So the idea is here that you choose your symptom which bothers you the most with the homeopathic remedy which displays the same symptom. It's like a matchmaking game, and then you will see results. The potency is 30, which is the number behind the name, and most of these remedies you can purchase in your local health food store or online, so it's not very complicated. In acute cases, I would choose 1 tablet every half an hour until the intensity of the symptoms subsides, and then follow it up with a management program, maybe 1 tablet morning and evening for a month or once a day. But here you need a professional guidance. If you require guidelines how to take these remedies, of course, contact my practice Medica Nova at health@medicanova.net or your professional homeopath. The first remedy is called colocynthus, and the main indication is abdominal pain, really sharp pain, almost colicky pain, cramping, griping, sharp, cutting in nature, to the point that you feel like you want to bend over, double, or even press your hands into the affected area. That relieves the pain a little bit, even temporarily. The pain can even radiate down the thighs or end up in the small of the back. Eating and drinking makes it worse. And as I said, there is a lot of distension, flatus, flatulence, farting. It relieves the pain a little bit, but then it comes back again. There can be also symptoms with nausea, vomiting, frequent stools involved, but the pain here is the keynote. Magnesium phosphoricum, also called sometimes magnesia phosphorica, you see it in different forms. 30 is specific if you have abdominal pain which is relieved by warmth. So you maybe put a hot water bottle on it and suddenly the pain relieves. Right? That is also a good remedy for that. The pain is cramping in nature, a lot of flatus, a lot of flatulence, and there can be even watery diarrhea to be seen. But if you feel it's relieved by warmth, magnesium phosphoricum. If the main symptom for you is constipation, which then leads to diverticulitis, for example, if you travel internationally, you have maybe clogged up digestive system, you can't go to the bathroom because of the time scales, and then you end up with diverticulitis, nux vomica would be a good remedy here. It's needed when you have this frequent, ineffectual urge to pass stool. So every time the person goes for stool, only a little bit is passed, and the urge is renewed again. The stool by then could be dry, scanty, always unsatisfactory. You feel like you haven't finished. It may also be blood-streaked, and abdominal pain may be felt before passing stool, that is then better after having passed the stool. Another remedy which comes to mind is bryonia for constipation in diverticulitis. By then the stool is very hard, is dry, tough, but quite large. And sometimes stool is so dry and dark that it appears almost burnt, and that differentiates it from nux vomica. The stool is passed with difficulty only after much straining, and there's maybe burning in the anus felt. A pinching abdominal colic may also be present. And with bryonia, motion makes it worse, so the abdominal pain comes on when you move about, but sort of reduces a little bit when you lie in bed or on your sofa and rest. If the diverticulitis is in an acute state and you experience vomiting and nausea, arsenicum album may be a good remedy here. So here we have this vomiting which appears soon after eating and drinking. Vomiting consists of ingesta maybe of this yellowish green liquid. We maybe see bile at this point, sometimes clear water. It is attended by excessive nausea. Along with these features, you have abdominal pain and a lot of anxiety and restlessness with arsenicum album. Sometimes there can be watery offensive diarrhea, but overall, because the person vomits so much, there's diarrhea, there's this marked fatigue and the weakness. They just feel exhausted from it. So you get the idea that diverticulitis maybe requires different remedies at different stages. In the acute states where the pain is strong, we maybe need colocynsis. At other times, when you have eaten something which triggered your diverticulitis and you end up with nausea and vomiting, you maybe want to refer to arsenicum album. Therefore, you need some guidance here how to manage this situation. If you have constant nausea in diverticulitis and it's not relieved by vomiting, right? So you had nausea already with arsenicum album, but if you vomit and it's not released and the nausea is still there, you then need a remedy called ipecacuanha. It's a nausea, it's quite extreme, it's distressing, it's persistent in nature. You know, ipecacuanha can be also nausea, constant nausea during pregnancy. It can be seen in different kind of situations of your health. It doesn't have to be just diverticulitis, but there's this constant nausea and it's not relieved by vomiting. There can be cutting and pinching calling in the abdomen present as well. The tongue is quite clean in this way, but remember this situation when you have nausea and whatever you do, it doesn't relieve itself. There are cases when you see blood in the stool, and here we want to bring in a remedy called nitric acid. And it's a great remedy when the stool is quite hard, dry, difficult, and irregular, and may alternate with thin liquid stools. And here it can be confused with irritable bowel syndrome, IBS. But with nitric acid, we also see a splinter-like pain, very sharp. Nitric acid can be also used for mouth ulcers when you have a splinter-like pain, right? Anything which has a splinter-like pain, nitric acid would be a good one. Like if you have piles, hemorrhoids in your anus, and you can't sit on a stool because you have a splinter-like pain, nitric acid will heal it. The same here with diverticulitis. The lower part of the abdomen is distended and very painful to touch. Of course, by then you need painkillers. But I can tell you, this remedy is so powerful, you don't need to take the painkillers. It hits it right there in the spot. If your diverticulitis is mainly expressed with diarrhea, you maybe bring in aloe. I talked about when I mentioned the supplements about aloe vera gel or a liquid. Well, there's a homeopathic remedy made from aloe, and it's very indicated if you have diverticulitis with the main symptoms of diarrhea. It manages this frequent thin yellow, an undigested food particle stool almost. In most cases, the urge to stool appears soon after eating. There's a constant bearing down feeling in the rectum that you have to go to the bathroom, but and there's this abdominal pain with bloating, especially on the affected side, lots of farting going on. There's also a discharge of maybe much offensive flatus, so the flatus smells very offensive with the abdominal pain. And the last remedy is if the flatus, the flatulence, is the most important symptom here, which causes you to have this abdominal pain. China officinalis, brilliant remedy. Also, often, can be indicated if you eat a lot of fruits and suddenly you get the diverticulitis. So there's a lot of bloatedness, excessive flatus. To the point, and yeah, we have to be frank here, you fart all the time. And as soon as the flatus relieves it, the abdomen bloats up again and is very distended. Of course, it's embarrassing, but that's part of diverticulitis symptomatology. So don't think, oh my God, this, everyone looks at me. Now really tackle it with the right remedies. The abdomen feels tight, very, very, you press on the upper surface of your abdomen and it feels very tight. And there's a lot of rumbling going on, moving of the flatus, bending over reliefs like cholesynthesis as well. Along with this profuse, watery, offensive stool, there may be marked debility. Like if you have a lot of diarrhea, you vomit on top of it, you lose a lot of electrolytes, you feel debilitated. You feel tired, exhausted, like arsenicum album. But arsenicum album doesn't have that much excessive flatulence present. So think about China officinalis. All of these remedies you can purchase in your health food store. Did you know that? Just look in your homeopathic section. And of course, each shop has more or few remedies only on offer. But if you can't get hold of it in your local health food store, then order it online. So I hope that today's video has inspired you to seek out more natural solutions, and they are available to you. If you have any questions about the suggested treatment protocols or how to take these remedies, contact my practice Medica Nova at health@medicanova.net. Have a look at my website medicanova.net at the online academy, where you will find certified, comprehensive, university standard home study online courses in homeopathy for the whole family, homeopathy applied during pregnancy, birth and postnatal care, mental health, health and wellness coaching, quantum healing, and so much more. And lastly, because now Medica Nova has also a national board certified department in coaching, we offer now 3 months very effective smoking cessation programs. So contact me at health@medicanova.net. Until next time, much love. Take care.